I can start with that. So I handed out beforehand this little set of slides. And so that's just to give you an overview of the population in Jefferson County. So it talks to you first about the household income as a perspective from West Virginia, and then regionally versus Loudoun County and Frederick County, unemployment statistics growing, commercial base, and the fact that we are going to need a significant number of new employees. So as you look at that third slide, you can look at Jefferson County, and that gold bar will show you that the projected employment growth between 2023 and 2024 is the highest, not only in the region, not only in West Virginia, but actually it's there above the average for the United States. Looking at the next 2 pages, you're going to see that population migrates significantly in the area. So there's an eastward southern wave every morning. So what I'm trying to tell you is we're going to experience a population growth. That growth is going to be moving quite a lot. We don't have, I'll bring you then to the missing middle, which is a slide in there, and you'll see that people leave Jefferson County right around 19 years old and don't return until 40 or 45. Part of that will be that next slide, which is we did a study last summer to find out, people said we can't find childcare for our employees at our businesses. We said, what does that mean? So we called all the registered businesses, finding out how many, it's listed on the state's website, how many licensed slots were available at every care facility, and when the last 2-year-old got into care. And we found that in Jefferson County, that was 13.3 months between seeking care and finding care. We looked at the same statistics for Berkeley County, and then you can see it was 6 months. Frederick County, it's 3 months. So it's not just perceived here. We've done the analytics, and it's over a year to find between seeking care and finding care in Jefferson County. This is a significant issue not only on a personal level. I have 4 kids that range in age from 14 to 3, and they're spaced out every 3 years. So I had to find care, and I've talked to a few other panelists here. I think I just took myself off Nickie's wait list, and I would almost be in. I put my name on her wait list in April of 2023, and I would almost be in now. So. And I also have federal employee background, which helps me get in there. So I'll not share her statistics later on. It is a huge issue. We found that the most significant issue for this is capacity. We have about half of the capacity per resident of childcare that Frederick County does. So if we can find a way to double our capacity, we'll be able to significantly reduce that wait time. I'll leave it there, and I'll probably bring up more statistics as we go along.
I can talk on a professional level. So at WVU Medicine, I mean, since COVID, it's been hard trying to get staff to come back to work, in the healthcare profession at that. And right now, our biggest problem is I'm interviewing people, but they don't want full time. They just want PRN because they can't find childcare for their child. So they're only working for me when their husband's not working, so that they can subsidize the childcare because they don't. So we don't have. And could possibly jeopardize the healthcare industry because we can't provide high quality healthcare because we don't have staff.
So for myself, I have 17-year-old twins, so I'm out of this world of childcare. However, one of the things I've been working on childcare with Tiffany Gale, one of the childcare advocates, for the past 2 years in my legislative roles, in trying to figure out what we can do. I was happy to support legislation in 23 that created a tax credit for businesses to open up and build childcare facilities within the business, but not all businesses can do that. A couple bits of statistics and some great news. I was at the Southern Legislative Conference at the Greenbrier over the past weekend, and I attended one of the childcare forums, and a couple of states that are nearer to us, Kentucky and Virginia, have pretty much lapsed us in what they've done for childcare for statewide in regards to funding, in regards to creating programs. One of the things that we are looking at that we were really interested in is both Kentucky and Virginia move childcare from DHS over to the Board of Education. This past May, during one of our budget meeting special sessions, we actually threw an amendment in on the budget to fund $23 million that would go towards a one-time child care payment. Now, that $23 million, unfortunately, did nothing for the child care facilities but paid them back what they were owed. So our state has an issue in regards to our codes that if the child qualifies through DHS, which is 85% of the median income for the state, then the daycare provider gets paid from DHS minus copays, things like that. However, as those who are in the daycare world and have kids at that age, you know that you rent that space for the entire week. And sometimes, especially when that child goes into kindergarten, you may pay that child care payment all the way through school, so you know next summer you have that spot at that facility for that child, so you're paying extra. We have to pay by enrollment. The state only pays by attendance, and the state pays 45 days after invoice. So when I grew up, first day of school was the day after Labor Day. So I would show up to my daycare facility on the Tuesday after Labor Day, and then I was sick for the rest of the week. The daycare provider only got paid for one day, and they didn't receive that check until November 15th. But yet they had to staff as if they had a full field. So we have some things at a state level that we are going to be addressing. We do have a subcommittee that has been meeting throughout the interim session to make some changes. The unfortunate part, and this is where Kentucky comes in, we have a supermajority of Republicans. And I can tell you, there's a lot of Republicans that feel that child care is not a state issue. If we model after what Kentucky did, and Kentucky has, like I said, a supermajority of Republicans as well, they have actually seen an increase of 4% in their workforce participation. State of West Virginia has the lowest unemployment rate in the nation, but we also have a 54% workforce participation. And the reason why is because people cannot go to work because they cannot afford daycare for their kids. 4 years of daycare costs more than sending your child to any college in West Virginia or Virginia. That's about it.
That's about it.
For now.
As a child care provider in this state of West Virginia, exactly what you're talking about, the Mountain Heart system is broken. So like he was saying, if we do have Mountain Heart kids in our center, how do we pay our staff while we're waiting on those checks? I've many things I could speak on that's wrong, like that I feel is personally and work related broken with the system. Like if I talked to a director today at another center about this, she has empty rooms in her center, but she can't staff those rooms because nobody wants to work for what we can afford to pay, because all of our funds come out of tuition or state funds, which we have to wait for. So if you're waiting for that money, how are you going to pay your staff? So she has an empty room. She can't find the staff to fill those positions to be able to bring in the children. I, on the other hand, have a waiting list. I don't have any openings until August of 2025 in my center. And like Eddie had spoke of, her child was on the waiting list and was just about to get in when things happened in her life, and that changed. I've had children on my waiting list that have never got into my center, and they went to school. I have people, like Hans was saying earlier tonight, that they go before they even conceive. They get put on my waiting lists, so they know that possibly someday they may be able to get in. I think a lot of the things that is wrong with what is going on with childcare, our staff has to have just as much degrees and more education than a public school teacher, but there's no funding that comes from the state and Mountain Heart obviously doesn't help. So how are we going to pay our staff to come to work and do high quality jobs? You want high quality care for affordable prices, but we can't afford to pay our staff a living wage. Like some of the centers are paying staff $9 an hour. Who's going to get out of bed for $9 an hour? Like, you can make more with no responsibility, no children's lives in your hands every day, working at McDonald's, Walmart. Not saying that there's anything wrong with that. We need jobs everywhere. Every job is important. But if we're taking care of children whose most important time in their life for brain development is birth to 5, and you're paying somebody $9 an hour, it's not working. So there has to be something done statewide. I think child care centers should be funded through the state, kind of like public school systems. Like the good quality child cares should be given money from the state for the work that we're doing to make sure that children are well taken care of and brains are developing the way they should be.
And Nickie brings up a really good point in regards to, we all love us some Chick-fil-A, don't we? You know, $15.50 an hour to start when you're 16 years old. The state median pay is $10.75 for a child care provider, and they got to go through all these other additional processes. One of the things that I would like to see our child care team come back with is a triple pay process. And what this is where myself, as being a business owner, I own Locust Hill Golf Course, you know, and if I could get incentives to pay child care for my employees, you know, a reduction in my payroll tax, I would, but we don't have it in play. Luckily for me, I only have one individual that would take advantage of that at this point. Everybody else has kids that are older. So, you know, I do give that individual a little bit of a stipend, but it's just a stipend. I'm not paying it directly to the child care provider that she has. So if we had employee, state, and personal pay, we could actually reduce the amount of coming out of the household and potentially be able to increase and make it more of a demanding job. I mean, early childhood education is probably one of the most important times of the child's learning process.
Right.
So,
Yeah.
good points. Thank you.
Yeah, and like what are you saying about working at Chick-fil-A and everything? Like, my staff doesn't make that, and they have college degrees and are working full-time and have to have 15 hours of training on top of their degrees every single year to maintain their ability to work in childcare.
And they get
So it's
yelled
like-
at just like the Chick-fil-A people do,
And
but
we
they
have-
also get spit up on too.
We have little brains that we're trying to mold every day. And one teacher might have 4 kids to take care of, but your pre-K teachers are looking at possibly 15 kids to take care of. Well, 12 really legally, but 12, 15 summer camp kids, you know.
Okay.
And
Yeah.
that's another problem too with summer camp programs. If we can't find the staffing to run the summer camps for that pay, most of them are public school teachers that are off in the summer that are giving up their time with their families to come and work too. So it's a lot to try to figure out.
I think you've all done a good job of establishing why there's that, and I'm using quotes again, perceived shortage. And I think, as you point out, Eddie, there is an actual shortage. We've got data to show that now. And you all went around the edges of this, but I think getting into the heart of it, what's the broader impact of this child care shortage on our community? And why should people who may not have child care concerns, maybe they don't have children, maybe their children are grown, why should they be concerned about this issue as well? So broader implications for the community at having this shortage, and then what's in it for the folks who don't have children or child care issues themselves at this time.
So I'll start with that. So obviously, in the state level, my role as Vice Chairman Economic Development and Tourism, this is one of the biggest things when businesses start looking at the state of West Virginia in regards to what is our education, what is our child care availability, what are all these things, because they want to make sure that their employees are going to be able to show up to work. So when you look at the broader implications, if we don't have people participating in the workforce, we don't have a way to bring jobs in. You know, some of these companies are coming in and they're promising 700-800 jobs when that's their promise that they're giving to the state, but in reality, these jobs are upwards of 1,000, and then you add in some of the ancillary, gotcha, John, ancillary businesses around that kind of thrive off of the business that's coming in. Now you have another couple hundred jobs that's built around it. So if we can't come to a fix on this, we're not going to see we're not going to continue to see budget surpluses that we've had over the last few years.
And so I'll kind of reiterate this in a different direction. Workforce is one of the number one things businesses look for when they're looking to locate, or it's one of the largest concerns when you're looking at retaining a business or growing a business, is how are you going to find that workforce? The state of West Virginia has said we need to allow and encourage additional in-migration. And when I see a wait list of over a year, I will say we can do a lot to address a workforce shortage issue by just addressing the workforce that we already have here and just removing the barriers for them to access the employment. Then when we are looking at what is the broader impact for people that don't have kids, one, if you have a business, you're not going to be able to find someone in that 18 to 35-year-old market or 18 to 45-year-old market. When I showed you how we have this missing middle, we're missing those people. When you go to the doctor, you may have to wait longer because there's not staff to be able to process. So I would say that's probably some of the largest impact to the broader community of people without kids.
Can you speak to, and I'll follow up on that because I think you made a valid point, and I'm give everyone else a chance as well, but this goes to Wayne as well, who not only is a delegate, but also on the golf course, you're an employer in the area, and even as a childcare provider, you've got an employer, and Kelly, you work with people. So when there isn't adequate childcare, and at least for me, it's the domino effect of illness. One of them comes in, sore throat, fever, I run them in, get an antibiotic, and I say, just give me 2, because I'm just going to go ahead and start on the other one, because it's going to be days off. So what happens to you when you get all those calls?
So I'll answer this one quickly. When I first bought the golf course, I mean, obviously I went through the whole thing that all business owners, standard operating procedures, did all that stuff, employment contracts, and you earn this amount of sick days and do all that stuff. And then shortly after, I realized that, there was, childcare issues. We got through COVID, all the other stuff. It's now, Wayne, I'm sick. I got to stay home. Kids sick. We got to stay home. Nothing we can do. Okay. And it's completely, I just don't even think about it. They just tell me, or hey, my mom can't watch today. I'm going to work from home. Okay. Running a golf course from home, for my GM is a little more easier than say, the golf pro, who's got to do lessons, but we're still dealing with that kind of stuff all the time. So, as a business owner, you just got to adapt to the troubles that you have.
And broader in the community still, but also talking about that when mom can't watch the kids and I say I can't, and it's some jobs are more conducive to work from home. It was no knock on you, Wayne, but Zoom was not the best golf lesson I ever had. I just didn't.
I'm not good at Zoom golf lessons.
Well, and it's just like in our business, like my workforce now is pretty young. Like when Hans's children came to the center, before COVID, like a lot of my staff retired right around COVID, so I have a younger workforce. None of them are in the beginnings of marriage or whatever, or having children right now, but if one of them came to me and said, I'm pregnant, like if I can't find care here, I'm not sending my child somewhere else, would be what they say, what am I going to do? So I'm out a teacher, so then I'm out of classroom because I don't have somebody to follow in to cover that class while they're out on maternity leave, or if they can't come back because there's no place for their child.
And a regular absence hurts morale and increases the workload, stress, and burnout on coworkers.
Well, and it stresses the parents out too, because they're used to dropping their child off every single day to the same person, and then that person's not there, the kid's acting out, the parents are upset, what's wrong with my kid, why doesn't he want to come to school? That whole trickle-down effect, then you feel bad about going to work because your kid's not happy at school. Well, it's not that they're not happy, they're just not adjusted to the problem.
Kelly, you were going to talk about
I
the-
was just going to say, yes, I agree. I mean, especially at the hospital, people, they've got kids. They have to call out. If you have to call out because you're sick, I mean, healthcare still has to go on. We can't stop. We've got patients coming in through the ED, at the masses, and we have to keep going. We can't stop. And right now, that's just, and since COVID, honestly, that's just what we've been doing. We've just been covering and making it work. But I will say, as a newer mom, I was an older mom, and then I have a newborn. I adopted a newborn. He's now 14 months old. But I kind of have seen a little bit of, so I've seen both aspects of it. Had been a while since I've been back into the new baby parenting area. But I've ran into the similar issues where I myself, had to take off work and miss work, and because he had a pink eye or whatever, and daycare wouldn't take him. But also something else I wanted to mention earlier, back to the Mountain Heart, is a lot of these. I was on the waiting list for a while, and I had to foster before I could adopt him, and a lot of places won't take Mountain Heart. That was another situation that we ran into. I think I called maybe 5 or 6 places, and I got denied from 5 or 6 of those places, not even being put on their wait list because he had Mountain Heart.
Yeah.
I don't know what the percentage is of how many people in Jefferson County have those subsidies, but I would imagine it's pretty large.
And a lot of the reason why the centers don't accept Mountain Heart, they can't afford it.
Oh yeah,
Because if you're being
just talked
paid
to
for,
somebody,
by
I
the
just talked
day.
to somebody this week who has a daycare and is literally taking out personal loans to help pay her staff
Yep.
because she hasn't gotten funding from Mountain Heart.
Yes,
And
agreed.
Hans, they're getting on something that's also really important is that the way the business model is set up for a child care facility, it's unsustainable. If there's nothing coming in regards to federal or state enhancements, it's a losing battle to try and run a daycare facility currently right now the way the structure is.
There's been times where I haven't taken a paycheck, so my staff could be paid. I haven't, or they haven't. It's just
I haven't taken a paycheck from the golf course in 10 years. I do the same thing. I give all of my money back
Back
to my
to the
staff
good,
and put it back in the golf course. I'm lucky I can do that. Many people can't.
right.
So it sounds like we've identified a number of issues, reimbursement models, a shortage of them, incoming growth. Who is doing what to alleviate the shortage of childcare options? I know Delegate Clark has talked a bit about some things happening at the state, but can you each speak to whose responsibility you think this is, or what kind of approach we as a community should take to trying to solve this short term and then long term?
So we help businesses at the Development Authority, and we help them by trying to address workforce issues, but also trying to get businesses solvent. So further in the packet, and sorry to bring you back to that, but I am definitely the nerd of the group.
We enjoy
So-
visual aids.
So increasing daycare capacity. So a couple of things. We have tried to attract the Y to come to Jefferson County. There isn't a Y in the Eastern Panhandle, and they are the largest provider of childcare in the country. And so that could be a huge drop in our bucket. Before, when I talked to you about the capacity, we need to grow our slots by about 900 slots. The child care facility run by the Y in the city of Frederick is right around 100, so that's a significant drop in the bucket. But again, it's only a drop. So how then are we going to grow those other 800 slots to increase our capacity? So we're working with several local facilities, trying to encourage expansion of their current facilities, working with the legislature on legislation they've been working on. He talked about the child care construction tax credit, which was for businesses to build child care facilities on site. But in Jefferson County, our businesses are primarily 7 to 10 employees. You can see how with 7 to 10 employees, it doesn't matter how much money you're making, you probably can't run a solvent daycare model when maybe one has a need. So what can we do to pool these smaller employers together to build one child care facility? And then finally, zoning regulations in the county are different at the county level versus the state level for the micro daycare centers. So that's, you'll have at the county level 5 or smaller are that micro level of daycare centers, and at the state level it's 6 or smaller. And you can hear how difficult it is to stay solvent as a daycare facility. So that one extra slot is pretty important, is pretty crucial to ensuring solvency when you're operating right there on the margin. Those are some of the things that we are doing just here at the county level with the Development Authority.
I know WVU, and I don't want to speak too much. I know YMCA is here. I know WVU has partnered with Jefferson County Building Authority and YMCA and has done some surveys from our staff, from our WVU medicine staff, to see where the need is. And I think the results came back as 100%. Yes, everybody was in agreement. There needs to be something for childcare. I think that's, as far as I know, that's still in the works. But that's where WVU is willing to partner with them. I think.
346 was the number.
Oh, there you go. So I looked at you because I was like, I know she knows the number. So, and I think the other thing is funding, helping Treehouse out and, helping them with the funding so that they can get more staff in here so we can open up some more slots.
So there's a couple things. One, I did introduce a piece of legislation last year, didn't get any traction. We'll be reintroducing it this year, and what it does is it solves our immediate issue that we have. We don't have the type of businesses that can build a daycare facility on site. So what we're trying to do is, if there is a local facility that is nearby the resident, the business, then we would give them that same tax credit on the amount that they're paying for childcare for the facility. So we would treat them the same way. Another thing that was important that I got out of SLC was the state of Virginia just recently passed a piece of legislation, and what it does is it takes out of the homeowners associations the code that they have that does not allow for in-home businesses, more specifically daycare facilities. So as we know, Jefferson County, our biggest industry is houses. And most of these houses are run by homeowners associations. Those homeowners associations actually have covenants and restrictions that do not permit home-based businesses. We would like to see a piece of legislation introduced. We cannot go back and change, I live in Huntfield, okay? We can't go change Huntfield's covenants and restrictions. I actually got them changed when I was on city council. So in Huntfield, you can do a home-based daycare facility. But you can't go back and change some of these that have been in place for 10, 15, 20 years. But we can make that restriction, and it goes towards the zoning process. We can make that restriction that they can't have it in future. And then if they start seeing you have, and what's happening in Virginia in some of these developments is you have one that has an HOA that restricts daycare facilities, and then right down the street is another one, same house, same price. Well, this one over here that allows the daycare facilities is selling faster. So the market's dictating what needs to be done. So I'm done.
I think to piggyback off of everything that everybody says, it's all great ideas. But as a child care provider, if I can't pay my staff, or anybody can't pay their staff a living wage, you can build all the buildings you want, you can have all the centers you want, but you're not gonna have the teachers in those buildings. So unless something comes from the state funding or federal funding wise.
Because your only other option is to increase the rates that are already high for sending your child there. So
Right.
I agree, because I want people taking care of my child. I love everybody that takes care of my child, and I think they deserve more than the $11 an hour that they're getting. So
Yes.
yeah, I agree.
Yeah. Yep.
So question to you all, first informative, and I think this rolls into perhaps another one of the issues. We talked about having to pay for attendance. So if I book a week, I'm paying for the week whether they get sick on Monday and don't go again or not. You can't fill that slot though, right, Nickie? You don't have a call list real quick to say, hey, I got one, so you then have staff and no kids. How much does that hit you?
I think what Wayne was talking about was the Mountain Heart program. Like I don't know of any centers, like I do drop-in care for children that are traveling with their families to NCTC for training. So if someone from Texas was coming to NCTC for a training, they could bring their child with them and they could enroll in my center for the week. My other spots it's all monthly tuition. So no matter if you come one day a week 3 days a month, whatever, you still have to pay for that whole month because I can't undersell it. Because you might come in tomorrow and say, oh, I need that spot, my child's better, or we decided not to go away, or something along that lines. With the Mountain Heart system, other than during COVID, because during COVID, they paid for the slot no matter how much it was being used. And now they're going back to only paying for when it's used. So if your child only comes on Monday, you're only using that spot on Monday. Mountain Heart's only paying for that spot on Monday, but Wednesday, Thursday, Friday, it's sitting there, can't be filled because that other child is still holding that spot even though it's not being paid for.
Mhm.
Does that make sense?
Yeah. Well, and WVU, I know, has traveling nurses. They have physicians coming in and visiting. We are a teaching hospital, so we've got lots of people coming in who might need childcare in Jefferson County. We do have commuters. We have people who might need to drop their children off very early in the morning, last-minute things. So this extends as well, I think, into all of the points you've been making, people wanting to come and be here because they have access to the things they need to take care of their families. Reminder that if you have any questions for the panelists this evening, want to contribute to the discussion, build on anything they've talked about, or follow up, Allison will be collecting your cards. Really quickly, we got our first one from the audience, and this is referencing the well-documented financial surplus in West Virginia right now. Can you talk about, and Wayne, this will probably be one you know the most specifics about, but what have been the barriers for the states to fund or subsidize child care and early education, and what's the explanation for why that hasn't moved forward?
Could you repeat that? Sorry.
Absolutely. West Virginia has a well-documented financial surplus, so why haven't we been able to move forward to fund or subsidize child care and early education in West Virginia?
I don't have an answer to that.
So, I'll honestly say it's a perception that many of those individuals that are on my side of the aisle feel that the government shouldn't be involved in child care. But what they're not realizing is that the government is involved in education. And that is one of the good things that I've seen, like I said, with Kentucky and Virginia, moving this over to the Department of Education. It's easier for those on my side of the aisle to say, you know what, I can fund education. I can't fund child care, because not everybody is involved with it. So that I think would be the easiest way to kind of sum up what's going on. Now, let's see, that amendment that we had for $23 million, we have 46 yays. So we only missed by a few. So there's more on my side of the aisle that understand the importance of it because they look at the economic development part of it and understand that education is education no matter what age they start at. So I hope that answers.
So it's my understanding that this also goes back to a fiscal note of basically how would we budget for childcare?
Correct.
And in the past, they have budgeted and said, okay, according to our budget for childcare reimbursement, we have spent this amount. We anticipate that this has grown steadily over a period. Maybe it's grown 5% annually. So we have spent X plus 5 is how much we're going to budget and then allow for reimbursement. So they can never then change to, instead of going to an attendance model, they always have to go to a reimbursement model. And this is always confusing to me. So I would love you to walk me through this. As a person who has been in business and has run several businesses, I always budget for my intended expenditures. And I would say if a child would go to my daycare center, possibly up to 5 days a week, I have to budget for 5 days a week. But the state of West Virginia has said, no, in the past, roughly they go 3 days a week or 2 days a week, so we're only going to budget for that, although we will allow for up to 5 days.
Correct. And I don't know how many people know, but DHHR up until 2 years ago was one organization, and then we broke it up into 3. And a lot of going through that process, we audited DHS, and one of the things that we found is that over time, this money that we were putting towards the Mountain Heart kids wasn't being used by DHHR at that time. So all of a sudden they said, well, what's all this extra money? So they were using it in other spots. So they slowly reduced the amount that they were requesting, but they still maintained the same amount that they were getting, and they used it to other spots. So now when we want to go back and back fund it, oh, it's going to cost us $23 million to make it whole. So you know, there's a calculation process that we're fighting with it, and I think one of the great reasons of moving it over to the Department of Ed, we can start at zero, and we can start all over again, and do an initial funding of it, and then just put it in part of the funding formula, and then we're set, and it stays there.
Well, and like, with the whole funding thing too, like I've said, we got grants for 2 years, and it was X amount of dollars per month from the state. And there was no figuring out like what you did with that money. There's no accountability for it. So some people went and bought a vacation home that were directors of centers, or they went and put a new roof on their house, or they went and bought a new Mercedes, and nothing went back to the center. So, and with that happening, knowing that I know it was COVID funds, but is there not a way, like I as a teacher or a director or whatever, everybody who works in my center has to be registered through STARS, which is another whole thing. They don't connect very well with the state regulations for the childcare centers, but have the centers be a STARS level. So every center, according to your inspection reports, like I've had 4 years of flawless inspections. So my center would be considered a high quality center. So it would be like a level 5. So that center would get more state funding than a center who didn't follow their state regulations, whose teachers weren't up to par, who like would only be like a level 1 or whatever. So that way the high quality centers that were doing good things for the children would be getting more funding from the state. And also, like if we're funding public school education, why aren't we funding the most important part? Like kids' brains do most of their development on who they're going to be between birth and 5. But it's never seen that way. We're always seen as lesser class citizens, lesser work, like we're not respected for what we do either.
I think childcare
So.
sometimes is perceived as babysitters.
There's not a TV in my center. Well, I take that
I-
back.
I-
There's
I-
a TV in my center, but the only thing that's on is the eagle cam when the baby eagles are being hatched.
Yeah, I totally
Or
agree.
eaten by their fathers.
My 14-month knows sign language. He
Yeah.
does on a regular basis is
Yep.
doing sign language.
Yep.
So yes, it's not just a
It's not babysitting service. Yeah. And that's why I think the name daycare needs to be changed also to early education.
Early childhood
Yep. It shouldn't be at the day that word. It plucks my nerves. It's a trigger word.
Are there things that could be done to ensure considerations and solutions for lower wage earners and job seekers, especially those folks who may rely on public transportation or ride share for work and childcare both?
I think there's funding out there already for childcare through Mountain Heart for lower paid citizens. So I don't see where that's an issue.
So that's-
the problem with that issue is that a lot of centers don't take Mountain Heart because they can't afford to.
The reimbursement's too low.
Or it's
or it doesn't fund right.
5 days later.
Sure. Well, no, if they said IOU instead
Right.
of a salary,
I can't run a
I'd have to
business on an
reconsider.
IOU, nor
Right.
can any other business.
But I guess so when we talk about, for example, we need to pay workers more, we need to make sure that they're doing quality things, that would certainly want to be across the board. Does it take more funding sometimes in areas where there are fewer resources? Your center is unique in that it's on this beautiful NCTC campus. There's some folks who might say, I feel like I'm good with kids, I want to open this up in my living room. Then they look at the barrier and say, I can't do all that, or, there's like, where do we draw the line for that, and then how do we make sure that we're maintaining a standard in all communities and meeting all needs that way?
I think you can have good quality childcare in any setting. It can be in a home care, and you're still doing great things with kids. I do a lot of trainings with staff on, of course, we're nature-based, so teaching other teachers how easy it is to incorporate nature into their center. So I think you can have high quality childcare in any setting. So it doesn't really matter if it's a home care, a center, or wherever. I think it could be good everywhere.
And I think I want to take it like a different spin because I'm not a daycare provider, but workforce is a pretty important issue. So then people who are in that ALICE population, that asset limited, income constrained, but employed population, how then are they able to access care and access care in a way that they're going to then be able to find and retain employment? So if you are looking for care immediately because you are accepting a job that where you start tomorrow, where are you going to find care? And in our community, what that means is your brother, sister's, niece's, nephew is going to watch your kid, and it's unlicensed cares, which you're going to be able to find if you can find care today. And then in Jefferson County, that means you're waiting up to 13 months. And so that population, it makes it very difficult to live in this county just because it's so difficult to find care. You may be able to find a job, but you can't go to that job because you can't find care.
And with our housing prices, we have a high poverty rate and a high homeless population in Jefferson County. So when you compare the cost of child care, the cost with what it is to own a home here, it's tough. One of these questions speaks to that. Is there some sort of glass ceiling on what child care providers can charge? The person in the audience here says they are surprised to hear the sentiment that higher wages can't be paid to the facilitators, or there are no entrepreneurial incentives for those for people to open new facilities. They're wondering how that is when the JCDA's demographic info shows such promise in household income growth, and the statewide incentives never seem to be proportional in the Eastern Panhandle, given that we have a favorable economic status compared to the rest of the state. And are there any local incentive ideas, such as a property tax credit, et cetera, to incentivize?
I think there's a market there. You could very easily open up a child care center. You can't open it easily. Opening a child care center is difficult. That's not what I mean to say. But what I am going to say is people are so desperate that they are going to be paying mortgage prices just to be able to get their kids into care. So there's a market there, but by and large, the population that is needing this is that 18 to 45-year-old population, and when we look at the overall median household income, it's taking in a significantly older population and wealthier population that's skewing that dollar amount higher. So those, and I don't have that in front of me, but those that are in the 18 to 45-year-old population are going to have a median household income that's lower. And then how are they going to be able to find care that is within cost? They're not. And so that's why you have significant numbers of people leaving the workforce and a reduced labor force participation rate, further reducing household income.
100% correct. One of the things, obviously, if someone wanted to open up a daycare facility, we know that Ranson Elementary School is going to become vacant here shortly. Someone buys that from the Board of Education and then opens up a daycare facility, they'll fill it up in a day. That's the next question.
The problem.
Can you get the staff? Can you just pay, your staff $20 an hour to do it versus $10 an hour? Like I said, it's a failed business model. It can't just be done because in order to do that, instead of paying $880 a month in Jefferson County for child care, now you're looking at $1,600, which is equivalent to, a single bedroom apartment right now is $1,600 a month. If you're renting, some 2-bedroom apartments are $2,300 a month. Well, if you're starting out, if you're in that 18 to 40 range and you just got out of college and you're beginning this process, you're only making $40,000 to $50,000. You can't afford to do this. So, there's so many other things. So just because Jefferson County, is well-to-do in regards to the rest of the state, we have significant issues in regards to cost of living that also hurt us tremendously, and there's no way around of bringing more money back to the counties where, it's just the way the Constitution is written and the way things are taxed, it just doesn't work. So we're creating our own little, issues. And I can tell you this, and John sitting in front of me, who served in the legislature for many, many, many years, we walk down there and we say, hey, we got issues. We got issues because it's too expensive to live in Jefferson County. Guess what the Southern Coalfield folks say? The exact finger that the gentleman just showed me back there. Yeah, it doesn't work. It does not work. They're like, I can't even get a job for $20,000.
We'd love to have your issues.
Yeah, that's what they say, and we'd love to have your issues. No, you don't, because our issues are equally as important as theirs. So it's a tough. The state, the regional dynamic of the state causes a lot of these issues to play out.
On what you had asked in that question too was, is there a ceiling? Like is there a ceiling on how much we can charge? So even though I'm housed on the beautiful campus of the National Conservation Training Center, I'm a nonprofit. I'm just housed on their facility. My teachers are not government employees. We're 100% tuition and grant based. NCTC does allow us to use the building for free, so I don't have rent. So that's a huge reason why my tuition isn't as high as some other centers, because it's high, believe me. I couldn't imagine having to pay for childcare right now at any center in our area. Luckily, my boys are 22 years old. So, and I dealt with this a long time ago. But anyway, so there isn't a ceiling on what we could charge. I charge what it costs me to run my center. I might end up at the end of the year with a $300 profit. It goes back to my staff, it goes back to the kids, and it goes into my food. Insurance are where my money goes. So even though we might be charged, it may seem like a crazy amount of money, we're feeding kids 3 meals a day and having to have high quality staff in my center who get paid pretty well compared to other centers with conversations I've had today, but it's still not enough for them to be 30 years old, college degree, and not be still living at home, or have a spouse that makes a lot more money.
Nickie, are you finding that insurance companies are starting to tighten down their restrictions on daycare facilities or not insuring them?
I haven't had any issues with that. I've had the same insurance company I've been there for 14 years. So we haven't had any, our liability insurance might go up a couple dollars a year, and it's mostly my board liability, not my center liability premiums.
Is that a barrier to entry for child care providers, the insurance? Is it more complex than just homeowners insurance or vehicle insurance?
I don't feel that it's more complex, the insurance policy. It may be if somebody said yes. It is. So I've never had to start my own policy, so I can't really say if it's more complex or not.
All right. So one of the questions that comes back, I think, especially after we hear about some of the barriers that exist in Charleston, especially when it comes to meeting the specific needs of the Eastern Panhandle, are there any realistic lobbying, messaging, or advocacy work that could be done at the state level to change that current model? Are there things folks in the audience, folks watching this could do to help get the legislature to realize this is an important topic and it does need to be addressed?
I mean, I have to say, the work that Tiffany Gale has done over the last 4 years, and she's a daycare provider up in the Wheeling area. She's actually in the District 1, so it's all the way up, very furthest point. What she has done in advocating for child care facilities she's there, blood, sweat, and tears, and she's doing it on her own. So, she's not a quote unquote lobbyist where she has a organization that's paying dues to her. She's doing this because she wants to see a difference in it, and I mean she walks the walk and talks the hallways, just like every other lobbyist that's down in Charleston. So I would say that the child care facilities should look at possibly moving Tiffany over to a lobbyist position. But here's the thing: they can't afford to make the payments for the dues of the child care advocacy group or whatever it is, because they're barely making their ends meet. So, but I anytime somebody brings up child care, I always give Tiffany mad props. And if you're watching, you got it.
We'll all drive down and take our kids to the rotunda for the day.
Oh, yes.
Let the delegates watch them.
Yes. Make sure it's upstairs, 'cause my office is downstairs and it's quieter.
Well, there's probably a large number of our representatives who would not actually be qualified to be licensed child care providers. And in fact, this next question wants to know if there's future legislation that's being evaluated to address those requirements for licensed child care workers and staff that would remove some of the more stringent parameters.
I hope not.
Can you elaborate on that?
Sorry.
No,
I hope
elaborate.
not.
That's
So I'm going to use this as an example. I had somebody come that is a foster parent in Berkeley County that came and applied for a job in my kitchen. So she wouldn't be direct contact with the kids. She would be my cook. She passed a background check to be a foster parent in Berkeley County. She could not pass a background check to be a teacher or a worker in a child care center at all, because of something that happened way long ago, but it was flagged and they're not allowed to work with children. Had nothing to do with children, no crimes against a children or any child or anything like that. But I think we need to be held at that higher standard because we are taking care of children at their most important time in their life.
I agree 100%. If someone brings into my office or says I need support on a bill that's going to weaken these restrictions or lessen them, I'm going to say no. These folks are teachers. They are, they are responsible for the well-being of kids. I would not support it. A lot of times, people will say, "Oh, we'll just lower the barriers and you get more people to come work for it and do all that stuff." Well, in this case, it doesn't work. So I'm 100% no.
The only thing I would say on that is that we have 3 separate sets of licensing regulations in West Virginia. If you're a home care, a facility, or a center, it depends on how many kids you have and all of that kind of stuff. We have 3 different sets of licensing regulations. And I don't understand why we have 3 different sets of regulations when we're all doing the same job. So no matter how many kids you're taking care of, I believe it should be blanket. And I've worked in 4 different states in child care. West Virginia has the strictest regulations of anywhere in the 4-state area, which blew my mind when I came to work here 14 years ago. But I think that it should be blanket regulations across all child care, no matter how many kids you're taking care of.
Nickie, can you expand really quickly? You talked about safety with a background check. Would you also say that the level of training required, even that 15 hours annual, is something that should remain in place that makes your child care center better to have that in place?
That's a double-sided question. I think it needs to be in place. I think it needs to be, this is a conversation I just had today. I think it needs to be better classes. Because if you have people that have been in childcare for a while and you're offering the same trainings over and over again and we have to take them, it's like, why am I sitting here taking this class? And I also believe West Virginia STARS is who we have to take our trainings through, that if there's a nationally accredited foundation that we could take something through, like NACI or Nature Start Alliance or AMBI, which is an association for nature-based education, that be approved as regular STARS hours, not as other hours, when it's coming from a national foundation, not just a state level.
And I think Nickie brings up a really great point that there are kind of 2 ways of looking at this. If these barriers, if it feels like there is a barrier because it requires a lot of training and certification of staff, is the answer to reduce that barrier, or is it to provide assistance to overcome that barrier? So the state of West Virginia has a number of resources like the Workforce Guarantee Program. The U.S. Department of Labor has apprenticeship programs to help, for instance, child care centers. When you have someone who's being certified, you can seek those resources. Well, they'll pay for part of the salary while someone is being trained and getting that certification so you can get over that hump. So there may be 2 ways to address the same issue. And it sounds like kind of universally this panel seems to suggest that maybe keeping those same standards, but then finding and knowing about what resources are available to overcome those barriers may be a different way of addressing the same problem.
We're close to the end of this section of this evening's program, but really quickly, one of the great benefits we have here in the Eastern Panhandle is not only a strong K-12 school system, but also a lot of post-graduation opportunities. Blue Ridge Community and Technical College, of course, we're here at Shepherd University. All of them have early childhood education programs. Are there things that could be done to encourage high school students to seek their certificate or associate's degree or a bachelor's degree in those areas? And could it become, since it's one of those areas of high need, one of those programs like teachers or nursing, where there's incentives to not only seek the degree, but then stay in West Virginia and do the work?
I think that's a great idea. I know WVU just partnered with Blue Ridge for a couple med ed programs through lab and through radiology, and that's proven already. We've already reached those high school students starting in their junior year. We've already got them signed up. They're going to be coming to the hospital and seeing what we have to offer, but I think it would be a good idea for the state to maybe help fund something like that that would help encourage students to go that route. I think sometimes, like I said, I have 2 older kids, and sometimes, I'm sending them off to college, and we're wasting a year of tuition because they're still trying to figure out what they want to do. So I think that's always a good plan. I think it's a good plan to get them early in high school to see what, try to help guide them. So
Right.
I think that's a great idea.
And that program filled up immediately.
It did.
So the schools offer a career technical education program, and they're often looking at how they can design different components to the program, similar to yours. And so we've worked with them looking at 911 centers. Can we use the high school career technical education to train 911 operators? So we're looking at that. And I think that this is an excellent opportunity. They may actually already have it. So, but I think it's a great question. Yeah.
I know that we have James Rumsey students that come every year, and I've hired multiple of them lately, and it's that come and do their observations or whatever. And so I know James Rumsey does offer that type of program, but there isn't like an incentive to go into that program because it's high school.
Right.
But I know in Maryland also, if you go, like, I used to work at City Kids, which was part of Citibank's childcare center, which was a ginormous center on the Maryland-Pennsylvania state line. And as the center themselves, if you went there and they helped you pay for your degree, associate's degree or whatever, bachelor's degree, you had to give so much time back to that exact center. So that might be something to look forward to or look into in West Virginia also.
Yeah, so a couple of things that we've done, some of the CTE programs that we've started where they start off in their junior year of high school. They start earning credit. They start going to the CTE as half days, and then they continue on that process, accelerates them through the associate program. But also in 23 was our first entry class of the Grow Your Own program, and that starts at a sophomore level and does dual credit process and works its way through the apprentice program for teachers, for educators. So we have that plan in effect, and actually we have this year, we have our first graduating folks that came out of the Grow Your Own program that started off in a junior year, so and now heading off to college with a year already under their belt. So we have these programs already in place. Some counties, Nicholas County, has a great nursing program that they do. Same type of thing. The kids start going into nursing classes in their sophomore and junior year. Anybody who has a high school level kid understands that most high school level kids, when they get that senior year, they only have 2 classes left that they have to do. They're at school for 2 hours required. What do they do for the rest of it? Well, they either go to work or they go, so the way our structure is set up statewide on our high schools, we have the opportunity to continue educating these kids in other things if they're ready to make that decision. So if this is something that we need to look at, I happen to sit on the education committee, and John could tell me if we've ever done anything like this before that I'm missing, because I don't think we have, but because John used to sit on the education committee with me. So, I I would be a champion on something like this. Anytime we can increase, the education and the speed of getting kids in the workforce, I believe is, and I say kids because I'm 52, but anytime we can increase that speed of getting individuals in the workforce is a great thing.
And that's what I've spoke this year with the teacher, James Rumsey, that does the childcare program. That I gave her a list because she didn't know. She was never told like what the students need to be able to be hired quickly into our program, because we have so many trainings and things that need to be done. Like they have to pass that background check before they can ever start working in childcare now.
Yeah.
So I told her, I'm like, these kids that are 18, sign them up, get their Identigo stuff done, their background checks done, so when they're already in the system, so when they come to look at a job or whatever, they can be directly hired. Because right now, you're looking at months wait for those background checks to come back before you can even let them start.
Thank you very much to our panelists this evening for giving us what I think is a much more complete picture of childcare here in Jefferson County, and I'm sure this extends around the state as well. Thanks to the Stubblefield Institute for letting me be a part of it. I hope to one day be a grandparent childcare provider, but hopefully we'll long have a solution way before that happens so that I can still travel. Be wonderful. I really do appreciate, though, the insight and the work that each of you do in your respective areas to make these issues known and to find solutions where possible. So I'll turn things back over to Ashley, but thank you very much, everybody.
Thank you.
So I'll repeat that. Thank you to Hans and Eddie and Kelly and Wayne and Nickie for sharing your thoughts and expertise related to the child care situation here in Jefferson County. And thank you to the Jefferson County Development Authority for choosing to partner with the Stubblefield Institute to bring this discussion to you. If you've enjoyed tonight's conversation and want to join us again in the future, you will definitely want to mark your calendar for our next event. And this is the first time that we are announcing this publicly, but on September 5th at 7 p.m. in the Frank Center Theater, we will be joined by West Virginia Senators Shelley Moore Capito and Joe Manchin for a conversation called Beyond Pepperoni Rolls. Who are we as West Virginians? The senators will be joined by the voice of West Virginia, Hoppy Kercheval, for a conversation about how we can move beyond the stereotypes to create a shared identity as West Virginians that we can all be proud of. Finally, if you enjoy or if you value creating a space like this for community dialogue, please consider supporting the Stubblefield Institute by either being a program sponsor or making a donation. We are part of the Shepherd Entrepreneurship and Research Corporation, which is a nonprofit, so your gift is tax deductible. More information about donating to the Stubblefield Institute can be found on our website. So thank you again for joining us, and we do have refreshments in the lobby where if you'd like to continue your conversations about what you've learned tonight, you are welcome to do so. Thank you so much.
Yes, sir.